السلام عليكم طلاب. محاضرتنا اليوم هي pulpitis. Pulpitis is the inflammatory condition of the pulp. It's the most common cause of dental pain and loss of teeth in younger persons. إذا تذكرون من السنين السابقة عندنا 5 classic cardinal signs of acute inflammation واللي هي الheat, redness, pain, and swelling, and loss of function. In chronic inflammation, of course, these signs are muted or absent. Now we are talking about acute inflammation. In pulpitis, pain is the predominant clinical symptoms. Other clinical features of acute inflammation are obscured. This is because the dental pulp is hidden off view. فعندنا 3 basic features about the location of the pulp that affect inflammatory response to infection. أولاً, the pulp is surrounded by a calcified wall. هذا result in limiting the pulp swelling. لذلك ما راح نشوف السويلنج اللي نشوفه acute inflammation in other parts of the body. Let's imagine our finger. لما يصير عندنا inflammation راح يصير swelling بالfinger. بالpulp, because it's surrounded by this calcified wall, الpulp swelling يكون limited و not visible to us. بعدين إذا نتذكر من السنين الماضية إنه أهم عامل بالإنفلاميشن هو البلد سبلاي. الفازودايليتيشن مع البلد فيزلز هي اللي راح تنطينا راح تنقلنا كل medical or chemical mediator of inflammation. In case of pulp, because of constricted blood supply via the apical foramen, this will limit the blood supply to inflammation area. And again, although we don't have like a clear swelling of the pulp, although this swelling is limited, بس مع هذا this limited swelling will cause strangulation of the blood supply to the area. The factor الثالث is that the tooth is embedded inside the jawbone. So this results in spread of inflammation to bone. فإذا تقارنون مثلا الانفلاميشن اللي يكون like بالفينجر بإصبعنا بين اللي يصير بالنيرف بالبلب، البلب يكون embedded بالجو والinflammation will spread to the jaw. The causes of pulpitis عندنا dental caries, cracked tooth syndrome، وهذه الاثنين ممكن نحطها بالكاتيجوري of bacterial causes. بعدين عندنا mechanical damage, traumatic exposure of the pulp, fracture of crown or cusp. بعدين attrition أو abrasion اللي يسبب لنا tooth tissue loss بالenamel والدنتين, which might lead to exposure of pulp or trauma to the pulp. بعدين عندنا barometric changes، هذا اللي يصير عند الطيارين والغواصين نتيجة الاختلاف بالbarometric pressure. Other causes, thermal irritation. when نسوي cavity و there is insufficient cooling during the cavity cutting, especially لما عندنا deep cavities, can cause immediate damage to the pulp from like heat generation. أو لما عندنا large unlined metal restorations مثل الأمالغام, which may cause continuous low-grade thermal stimulation that damage the pulp over a long period of time. ممكن البولبايتس تكون بسبب chemical irritation، مثلا the inappropriate use of acidic dental materials، أو sometimes restorations without protective lining, especially in the past when we were using silica. This will be enough to irritate the pulp and cause its death. إذا تشوفون بهذه السلايدز, the one on your right is a decalcified section. نشوف acute pulpitis. If you see the occlusal caries penetrating to the pulp horn, and there is the occlusal caries penetrated to pulp through a layer of reactionary dentine, هذه المنطقة, and there is an acute inflammation localized to the pulp horn. فإذا تبعون بالpulp horn area أكو infiltration of inflammatory cells. The slide on your left side, عندنا هنا الpulp died beneath the crack. هذا الكراك clinically it wasn't detected, لكن ورا decalcification of the tooth and on slide preparation ظهر لنا under microscope هذا الكراك هنا والpenetration of bacteria and damage to the nerve. الpulpitis could be classified as reversible pulpitis أو نسميها الpulp hyperemia, reversible pulpitis, and reversible pulpitis can be divided into acute pulpitis or chronic pulpitis. Acute and chronic pulpitis, again, it could be either closed pulpitis or open pulpitis, وراح نجي على هاي الكاتيجوريز كلها ونشرحها one by one. الpulp hyperemia أو reversible pulpitis. The causes of pulp hyperemia: caries, cervical erosions, occlusal irritation, operative procedures, لما نسوي filling أو any other operative procedures, deep periodontal curettage أو enamel fractures. Clinically, a toothache elicited after stimulus, usually cold, sweet food, but sometimes with the heat. And sometimes this might happen after replacement of dental restoration. With like a drilling and using material, we might irritate the pulp and cause transient hyperemia or reversible pulpitis. لذلك من نسوي حشوة لازم we should warn the patient إنه بعد الحشوة نتيجة الirritation اللي راح يصير للnerve they might have this toothache. So it's better to tell them and warn them rather than they will have these like symptoms will come to your surgery complaining. فإذا شرحت له بعد ما يرجع لك للعيادة راح تبدو أمام المريض كأنه تقدر تنطي excuse for something that shouldn't happen. بس إذا قلت له قبل ما بديت procedure like this will show that you know what are you doing. The pain with reversible pulpitis is not continuous, it's only short-lived pain, and it's usually subside after a few seconds after elimination of stimulus. فالبين بس نعيد البين يبدي نتيجة stimulus ما عندنا spontaneous pain ويكون short-lived مو constant pain subsided after a few seconds after elimination of stimulus. بالhistopathology راح نشوف pulp congestion with increased number of capillaries اللي تبدو like engorged. Odontoplastic layer تكون intact. The cell-free zone is obliterated with capillaries and cells, which is not normal. ممكن أن نشوف pre-dentine and even irregular reparative dentine produce as a result of severe irritation or deep caries. هسه راح نشوفها slides. هذا الديسكريبشن اللي قلناه. هذا النورمال هيستولوجي. عندنا cells layer of pulp is the odontoblast layer, the first layer, بعدين followed by a cell-free zone, بعدين a cell-rich zone, and then the pulp core واللي بيه vessels والnerves. So this is the normal like histological appearance of pulp and dentine. فشوف dentine, pre-dentine, odontoplastic layer, cell-free zone, cell-rich zone, and pulp cone. لما عندنا hyperemia راح نشوف if you see like there lots of blood vessels كلها تكون يعني congested. The odontoblast layer intact. This is why it's reversible, because still have like these plastic cell اللي لها القابلية على الريبير. self free zone إذا تلاحظون بهاي المنطقة كلها infiltrated by cells and blood vessels, which is not normal. Okay. عندنا pre-dentine, عندنا even sometimes we might see irregular reparative dentine. الdiagnosis يعتمد على الفيجوال لما يعني like intraoral examination, checking for caries using a probe, or we will check for disturbed occlusion or any fracture in the tooth. The patient's history ينطينا pain which is off with the removal of stimulation. On our examination, the tooth usually is not tender to percussion. The vitality test, the tooth will react to cold stimulation, but the pain will disappear within a few seconds after removal of cold stimulation. And when we test the vitality using electrical pulp tester, we will need less current to cause pain in the tooth. Radiographically راح ممكن نشوف depth of caries or cavity penetration واللي ما تكون like deep and penetrating the pulp chamber. The periapical tissue are normal. There is no any dilatation or in the lamina dura or periodontal ligament area. The treatment is simple restoration of the area of the tooth which has small cavity would provide relief. Usually endodontic treatment is not necessary, and when like the symptoms relieved and we did the treatment, we will check the vitality again and we need to check for the absence of pulp necrosis. The treatment of irreversible acute pulpitis is extirpation of the pulp or root canal treatment or extraction of the tooth. بالhistopathology راح نشوف area of hyperemia which is immediately beneath the irritant. نشوف inflammatory cell infiltration with destruction of odontoblast. إذا تتذكرون قلنا بالreversible الodontoblast layer تكون intact. بالirreversible راح نشوف destruction of odontoblast layer. Then ممكن نشوف a limited area of necrosis which might lead to a small abscesses localized by granulation tissue formation. Later stage, the inflammation might spread until the pulp is obliterated by dilated blood vessels and acute inflammatory cells. واللي هي mainly neutrophils. On a later stage ممكن راح يصير عندنا complete necrosis and the pulp might die, so the treatment will be pulp extirpation or tooth removal. Okay. Now عندنا two histological or histopathological sections. On our left side الhyperemia, on our right side الacute reversible pulpitis. إذا نسترجع بالhyperemia عندنا enlarged blood vessel, an increased number of blood vessel, and we will see intact odontoblast layer, pre-dentine, and inflammatory infiltration. إذا نقارنها ويا السلايد on our right side عندنا beneath the caries exposure أكو عندنا dense inflammatory infiltrate and the pulp is intensely hyperemic. أهم character is the destruction of odontoblast layer in this area. إذا تشوفون هنا الodontoblast destroyed in this area, inflammatory infiltration and blood supply. فهذه المراحل الأولى للبلبايتس. بعدين at a later stage إذا تباعون هنا أكو عندنا الانفكشن penetrated through reactionary dentine رايح للبulb horn، أكو pus formation، أكو abscess formation and is limited by granulation tissue formation. On a later stage the entire pulp destroyed and replaced by inflammatory cells and dilated vessels. Okay. Now the chronic pulpitis. Chronic pulpitis may develop with or without episode of acute pulpitis. فمن الممكن أن تكون chronic pulpitis followed acute pulpitis, or from the start it started as chronic pulpitis. Clinically راح يكون عندنا dull, throbbing, bearable pain and usually brought on by hot or cold stimulation, or it might come spontaneously. The pain is intermittent، يختلف عن البلبايتس اللي يكون constant, continuous, sharp stabbing pain. Patient may cope with the pain and there are often prolonged remissions, but there may be recurrent or acute exacerbations. The offending tooth may have deep caries or extensive restoration. Now, pathology. عندنا mononuclear cell infiltration with more vigorous connective tissue reaction. هسه إذا نسترجع الacute pulpitis عندنا polymorphonuclear cell infiltration أو neutrophil cell infiltration، واللي هي دائما نشوفها يعني ال predominant cell بالacute inflammation. بالchronic inflammation راح يصير عندنا mononuclear، عندنا lymphocyte، plasma cell اللي هي predominant بالchronic inflammation. ممكن نشوف small area of pulp necrosis and again there might be pus formation and localized by a well-defined wall of granulation tissue. Small abscesses may form and sometimes this might be very local and the remainder of the pulp appear normal. مرات نشوف هذا inflammation underneath a calcified barrier with the considerable amount of reactionary dentine continue to form around the opening. The end result even prolonged, but pulp necrosis and death is sure. Therefore, treatment is either pulp extirpation or tooth removal. عملية الكرونيك inflammation هي عملية هي process or attempt or to heal. تختلف عن الأكيوت. الأكيوت يصير response to irritant is just to like a defense mechanism to localize the area. الكرونيك اللي يجي بعد الأكيوت what a defense is like an attempt for healing. مثل ما تشوفون بهذه السلايدات، عندنا بالسلايد اللي على اليسار عندنا chronic pulpitis. إذا تشوفون هنا أكو عندنا calcified barrier، بس مع هذا أكو عندنا abscess formation below it، وأكو inflammatory invasion in the pulp below it. هذه واحدة من السلايدات اللي شووا في calcified barrier اللي induced by pulp capping اللي احنا نسويه لما يصير عندنا exposure ونخلي calcium hydroxide or pulp capping to enhance calcified layer formation to protect the pulp. بس مع هذا تشوفوها هنا صايرة على شكل irregular and this calcified barrier fail to block the infection or to hold back the infection from infiltration. فبوجود هذا مع وجود هذا الكالسيوم barrier نشوف أكو infiltration بالpulp with the inflammatory cell and increase vascularity in the area. هسه الأكيوت pulpitis والchronic pulpitis اللي حكينا عنها سابقا هي كلها closed reversible pulpitis. الopen pulpitis اللي يصير عادة لما عندنا open abscess بالend of the tooth because wide abscess will allow adequate blood supply. This will help the pulp to survive. بالرغم من إنه هو chronically inflamed. فإذا تلاحظون هنا الtooth still alive. There is no necrosis. بعد tissue alive but is like heavily invaded by inflammation or inflammatory reaction. واحدة من الentities of open pulpitis هو chronic hyperplastic pulpitis أو pulp polyp. هذا بالرغم من وجود wide exposure و heavy inflammation بس الpulp يبقى يعني survive and not only survive even it will proliferate through the opening. It will lead to formation of a polyp inside the tooth. هذا البوليب قد يبدو dusky red or pinkish soft nodule يعتمد على maturation of the tissue. It's usually painless, but sometimes it might be tender and bleed on probing. To distinguish it from gingival polyp, بالprobe we can trace its attachment بالprobe نتبع الاتاتشمنت مالته. إذا شفنا الاتاتشمنت للجنجفة فإذا gingival polyp. بس إذا شفنا الاتاتشمنت مالته بالpulp chamber فإذا is a pulp polyp. Histologically ممكن أن نشوف few odontoblasts still survive والpulp totally replaced by granulation tissue وممكن بعد فترة يكون when it's mature this granulation tissue replaced by fibrous tissue. وبهذا البلب إذا تشوفون it's not only survive and proliferate حتى يعني protected by epithelial layer. تشوفون هنا عندنا stratified squamous epithelium covered this polyp. So this will protect this polyp and allow the process of replacement of granulation tissue by fibrous tissue. This degree of pulp proliferation can occasionally seen in a tooth with fully formed root. إذا تذكرون إحنا الأوبن pulpitis ذكرنا إنه عادة تصير لما عندنا wide opened apex that allow a good blood supply to the pulp اللي راح تعطي القابلية إنه stay alive. But لكن in case of polyp حتى ممكن نشوفه بالadult tooth with fully formed roots. The treatment of open pulpitis عادة يكون open pulpitis associated with gross cavity formation, and very rarely we can save the tooth in spite of like the tooth the pulp is vital. لكن في بعض الحالات خصوصا بالwide apices if the tooth savable ممكن إنه we remove the caries, remove the polyp ونحط pulp capping and monitor the tooth vitality after. Endodontic treatment in this case is not accepted because first of all, as we mentioned, we have large apices foramen. We can't achieve a proper obturation and apical seal بالendodontic treatment. بعدين if we remove the pulp we will destroy the odontoplast and this will lead to stop root development. If the tooth is not savable, then the best thing is to extract the tooth. عندنا pulp calcifications. عندنا two type of pulp calcification. عندنا pulp stones اللي يصير عندنا في round masses of dentine which may form within the pulp and can be seen in radiograph as small radio opacity. هذه pulp stones is a developmental anomalies and for unknown reasons نشوفها هواية بالpatient اللي عندهم Ehlers-Danlos syndrome اللي هو يتميز بالgenetic defect of collagen formation. Histologically pulp horns تكون متكونة من dentine which may show complete or incomplete tubules formation. وهذه الستونز ممكن تكون free بالpulp وممكن attached especially بالpulp chamber. Sometimes لما نفتح الpulp chamber نشوف stone بالmiddle of it. The other type of calcification is diffuse calcification. إذا تشوفون هنا بهذا السلايد عندنا amorphous calcification وتكون diffuse in the pulp. It's not like a round group. هذا mostly related بالdegenerative age-related degenerative changes. Two types of calcification, pulp stones and diffuse calcification, are of no clinical significance, except when it may interfere with endodontic treatment. So otherwise we can ignore them. Pulp necrosis, or death of the pulp. The pulp when the pulp has been killed by painful acute or chronic inflammation, clinically the pain will disappear because of the death of the pulp. The tooth clinically ممكن نشوف التooth with deep caries or extensive restoration. لما نسوي ال vitality test it will be negative, and for in these cases the best treatment will be extirpation of the nerve or a tooth extraction. The pulp necrosis may follow either pulpitis or it could be due to trauma. تتبعون بهذه الصورة. Injury to the apical blood supply راح يؤدي للcoagulative necrosis due to ischemia. وإذا تشوفون discoloration هنا gray or yellow discoloration اللي نشوفها tooth necrosis due to trauma. The 8 changes in pulp and gradually decrease in volume due to secondary dentine formation. فإذا تقارنون اليونج tooth ويا الأولد tooth تشوفون أكو decrease بالvolume of the pulp, decrease بالvascularity and cellularity of the pulp, increase in collagen fiber content because it's become more fibrous, وبالتأكيد راح يصير impaired response to injury and healing potential. And there is possibility of increased pulp stones and diffuse calcifications. هذا الدايجرام إذا تحبون تتبعوه يعني هو خليته لكم اللي يشوف يسهل عليه يعني الفهم ممكن يستفاد منه. The factors influencing the outcome of inflammation of dental pulp, if it is reversible or irreversible, or it might lead like this, irreversible, this might lead to pulp necrosis. الفاكتورز اللي affecting this هو nature of irritant, the duration and severity of irritant. بعدين عندنا ال pre-existing state of the pulp itself, the local anatomy of the pulp chamber, بعدين ال apical blood flow, wide abscess, closed abscess, and finally the host defense. Okay? Thank you for listening.